y'all, it's Dr. Lauren. And so in this first episode, it is going to be about all things breastfeeding. So there's going to be an amazing interview coming up with myself and Dr. Jess. Dr. Jess is a pediatrician. She works in the Nicu, which is like the ICU for babies. And she's a mom. And so we're going to talk all things breastfeeding and give you just so much good information. And I want to tell you a little bit about what inspired this episode. If you follow me on Instagram, which you should all be following me on Instagram, I shared a lot about my breastfeeding journey and about the challenges that I had, even as someone who, I'm a family medicine doctor. So that means during my residency and training, I worked in the OB unit, I worked in labor delivery, I worked with new moms, I worked with, little babies, and kind of had an understanding about breastfeeding and things like that. But when it was difficult for me, boy, it was a journey. It was definitely a journey. And so, just to kind of give you a little bit of a summary, I had delay in my production and then I had low production. And that happened multiple reasons. I had a C-section, and so that can delay things. And we'll talk about that in the interview. But the main thing is I had breast surgery back in 2017. I had a breast reduction in residency, which I regret in no way at all. My surgery improved my lifestyle. I had large breasts for my entire life, I feel like. Lots of shoulder, lots of back pain, and just not able to move the way I wanted to move, and not feeling just great about my body because I felt like my boobs were so huge and it's the first thing people see, and just not feeling good in my body, to be honest. So I'm saying that to say I don't regret the surgery at all. I actually had a plastic surgeon reach out to me on Instagram and thanked me for kind of saying that, because she's like, I need to know how to counsel my young women that come in and desire this surgery, and just counseling them appropriately. So I don't regret the surgery at all. But what's happened is I've had very low production my entire way through. In the hospital, postpartum, and even now, I have low production. So I'm basically making enough milk to make one full bottle. So I pump 4 to 5 times a day. And each pumping session, I'm able to pump about 1 ounce, sometimes a little less, sometimes a little bit more. And then I nurse at nighttime. Sometimes I nurse in the middle of the day around 3 o'clock, but not always. And so my production has been low, and it's been very early on so defeating, right? Because as a mom, a new mom, you feel like, this is my job. I'm supposed to be able to, provide food and nourishment for my child, and I'm not able to. And desiring to do that, but being physically not able to, it's just jolting. And, I'm so thankful for a supportive husband who kind of was like, I think men, they don't understand why it's so important to us, but it's just like, you're doing a good job. Like, why is this, affecting you in this way? And it's just something that you cannot describe. It's just undescribable. But my production has been low. I used a hospital grade pump for a while. I don't really think that made a difference. my production increased a little bit, but I think it was going to anyway, just with time. Because I had the surgery, the lactation consultant in the hospital told me to give it about 12 days, 14 days, that it just may be a delay in my milk coming in. And so just to give it time, I met with 2 lactation consultants. One was at my pediatrician's office, and then one was with the company that I had rented my breast pump from. So they also have lactation consultants. So I kind of met with both, and it was great to meet with both. They had very different perspectives. And I can say, like, my lactation consultant that was at my pediatrician's office, she was someone who has PCOS and has children, and so desired to feed her baby breast milk and nurse her baby, and was able to for a little bit, but then her body just could not keep up with, as her baby grew and needed more, her body wasn't able to keep up. She had a perspective that was just so graceful. Like, she gave me so much grace, the grace that I was not able to give myself. And so when I came in, just like a mess, frustrated, defeated, sad, and exhausted, because essentially I was nursing the baby, then pumping, and then giving the baby a bottle because it still wasn't enough. And so to be doing all those things every 2 hours, 3 hours for a 24-hour period of time, it is exhausting. And even with my husband helping at nighttime, which is great, if I'm still waking up to do all these things, I was never really getting rest. So she helped me come up with a plan that included rest, which definitely did my body well. What I currently do, and I am at the time of this recording 6 weeks postpartum, and what I currently do is I pump about 4 to 5 times throughout the day. So I get about 4 ounces or so, And so that gives my baby, you know, one full bottle. And then I, again, nurse at night, and then I don't pump at night anymore. So no more pumping at night. So when I go to bed and I finish sometime around 11 o'clock, I'm not pumping again at night. And if my husband has a baby, that means I just sleep at night. If I have the baby, then I'm waking up to just give him a bottle of, you know, twice over the night, and then waking up in the morning, you know, around 5 or so, and then I'll maybe pump again. So I'm giving myself that 6 to 7 hour window where there's no pumping involved, and I'm really just resting, and it's done well for me. How long I'm going to keep this up, I don't know, because it's still kind of a lot to be doing all this for, you know, to produce that amount of milk. But at this point, I feel content, and I feel very happy to be able to provide my baby with just one. You know, if he does 6 to 7 bottles a day, I know one of those is full of breast milk, and that makes me happy. That makes me happy. So I want us to get into this interview with Dr. Jess. I want to introduce her. But first, I just want to share a couple of things that really helped me in my like breastfeeding nursing situation. So I made a list, and so I'm going to read my list so that I make sure that I don't forget anything. So first of all, having a nursing pumping bra is like so huge. And I would say bring it or wear it to the hospital because it just makes things easier. So, you know, when you pump, like the little suctions go on your boobs. And so if you have a pumping bra, it's a bra that kind of holds those in place so that you're not holding with your hands. So now you have free hands. So yeah, just wear it to the hospital, a nursing bra or a pumping bra. And some bras are nursing and pumping, and some are just nursing. So a nursing bra is just going to allow you to pop your boob out. The pumping bra is going to actually have the things so that you can put in your attachments. So bring that to the hospital. You want to have tops that can button because it's just so much, button or zipped. It's just so much easier to kind of like open to either nurse or to do skin to skin or to pump. So zip or button. Pads, there's all kind of pads. Like these are like gel pads that you can put in the refrigerator and then, you know, kind of put them on your boobs after you've pumped or nursed, and they're just cooling and kind of just add some comfort. A breast oil, those are great. Breast oil, breast lotion. Honest has one that I really like, and it just helps with like the chafed nipples. You want to have a good setup in whatever room you're going to be pumping in. You know, I guess this advice is mostly for pumping. I'm going to attach a picture of what my setup looks like, but just having like a comfortable chair. We have a mini fridge in our bedroom now, so that way when I pump, especially, you know, in the later times of the night, I can just put my parts in the fridge and I don't have to wash between everything. When I pump and I'm collecting milk, I can just keep it in the fridge in the room rather than having to go downstairs and put it in that fridge. So just have a good setup. I ordered an extra lamp because you don't want to turn all the lights on when you want to pump and do all these things at nighttime. So just having a lamp that you can turn on and it doesn't wake everybody up. I think having multiple pumps is good. So I have a pump in my bedroom. I have a pump in the kitchen because that's kind of where I spend most of my time. And so if I want to pump, I don't have to like go get one pump. So having multiple pumps and multiple attachments is good. Lactation consultants, I think, are amazing, so full of knowledge. So definitely talk with your pediatrician to see if they have one in their office. I thought it was amazing that they had one in the office. When I was in the hospital, the lactation nurse there gave me a list of lactation consultants in the community, and my insurance covered all of them. I just had to pay a copay. So definitely find out what resources are available to you. Even if you can meet with one before, like before you have the baby, that's great. Just to establish a relationship. That way, when you get out of the hospital, like you have someone and, you know, you guys can just kind of go with the plan. I also liked having a heating pad. There's been studies that show that women who, you know, use a heating pad for 20 minutes or so consistently, it kind of really helps with the milk flow and being able to extract more. And so I noticed a difference, and I like the way it felt too. So I have a heating pad that I would throw in the microwave and put on my breast and kind of massage them at the same time. I have a breast massager. I'm looking because I thought I brought some of these things, but I don't. But having a breast massager, and I would use that before pumping or before nursing. It also helps if you ever get a clogged duct. You can kind of just, it vibrates and you can kind of put it in those areas. Other things like having little lactation snacks, so like the lactation cookies that are made with oats, which is what is supposed to help with breast milk production. A mother's milk tea, which has fenugreek, which is like the thing that everybody says to take and to help with breast production. So I drink that usually like once a day. Another thing I have at my pump station is like this new parents devotional. And I'm, you know, It's one of the things I look forward to when I'm sitting at my pump is just, reading the devotion for the day. You guys know there's like a million supplements out there. So this was recommended to me by one of the lactation consultants I saw. It's for the brand called Legendary Milk. And so they have a ton. And so I used Liquid Gold and I used something pump, Pink and Pump something. I think they were helpful. I don't really know how significantly helpful they were. I'd say, yeah, I don't know. Part of the problem is I did multiple things at the same time, so it's kind of hard to say what helped. I can say that the mother's milk helped. Like I would see a difference if I use it or didn't use it. This stuff, So the fenugreek, the fenugreek is also in this stuff too, which is kind of like this chocolate covered lactation drink. So what I do is I fill up a mug of oat milk, I heat it up in the microwave, and then I add this, and it tastes kind of like hot chocolate. I do notice a difference when I drink this, and I like this. So I drink this or the tea once a day. Oh, Boppy pillow. That's really great for breastfeeding. It's a pillow that kind of clamps around your waist and you can sit there and you can put the baby on it, and it just is helpful so that you're not having to like hold the baby. So the baby can sit there, you can support the head and hold your boob at the same time. The last thing I would say is I think it's really important to have objective data, because what happens is you can feel, and this is more for breastfeeding, if you're nursing, then your baby being satisfied and having wet diapers is like, that's all the data you need. But sometimes when you're pumping, it's hard to know, like, are things getting better? I mean, it seems the same. Having objective data where you are like literally recording, and this might be more anxious provoking for some, but for me, it was helpful to actually record how much I was pumping per each session. And that way, when I looked back, I could see that, Lauren, it really is increasing. It really is getting better. It made me feel better. So there's two apps. One is called Cuptail, and then the other one is called, I forget, but I'll include it. But just an app to record how much you're pumping and how many mLs or ounces that you're getting per pump session, and recording that and having it as some objective data, I think is just super helpful, because then you're not going based on, well, I think it's getting better, or I think I have more. You really see it. All right, you guys, so let's get into this interview. Let me introduce Dr. Jess. I want to not miss any of the good stuff about her. So like I said, she's a board certified pediatrician. She works in the Nicu. She's a founder of Mom and Me, and she's a mom of 2 beautiful children. She has an upcoming in-home and virtual postpartum care service that's going to provide medical care to newborns, as well as, education and support to the new moms, which we all need. Emotional and practical support during that 4th trimester. We always talk about the 3 trimesters when the baby is growing, but that 4th trimester, which is the first 3 months when the baby is on this side of the world, can be a lot for both the baby and mom. So having that support. Her goal is to help new moms and NICU moms transition home after birth of their baby. She believes that new moms have to take care of themselves in order to take care of their little ones. I believe that too. And that motherhood requires a lot of on-the-job training. Definitely does. She offers one-on-one coaching to new moms to adjust to motherhood. So I hope you guys really enjoyed this interview. And again, I just wanted to make sure I provided a place that had really good information, because there's so much stuff out there on the internet. And so I hope that me sharing my story and you guys having this information from Dr. Jess is helpful. I want to remind yourself to give yourself grace. I want to remind you that you're doing a good job. I want to remind you, whether you breastfeed your baby or give your baby formula, you're a good mom. Whether you breastfeed for a week, whether you breastfeed for a day, whether you breastfeed for 2 years, it's your choice. And either way, it's fine. Either way, it's fine. All right, enjoy. All right, Dr. Jess, so thanks so much for being here. I can't wait to talk and chat with you.
Thank you for having me. Glad to be here.
So, you kind of like talked me off so many ledges. I think I met you because somebody, like, I was posting on my Instagram stories often about like my breastfeeding struggles, and somebody actually tagged me in something that you posted and told me like I should follow you and stuff like that. So that's how I started following you.
Okay.
And then somehow we just started talking, and then somehow you just started like,
Yeah.
being my angel and helping me with all the things.
Well, that's good. I know I saw Barbara Jones, who I call Dr. Barbara Jones, who I call BJ.
Yes, I love her.
For the breastfeeding webinar that I did. So I was like, oh, that's cool. And then I saw you were local, because I'm learning about a lot of people being kind of in Atlanta. Like a lot of people are here more than I realize, actually.
Yes. All right. Well, I thought we could just, you're an expert. You do this for a living and you have children. So I thought it would be just a good place for us to just kind of go through some just like nuts and bolts of breastfeeding, so that people have like a place to go
where
Okay.
it's trusted information. Because, there's just so much stuff out there on the internet. I
Yes.
found myself, even as a physician, Googling stuff in the middle of the night while I'm breastfeeding. And I'm like, is this right? Should I be doing this? And so it's
Yep.
just good to have like a good, reliable, trusted source. Of course, we want people to talk to your own doctor and,
Yep.
your own lactation specialist. But if you're in the middle of the night and you're Googling and, hopefully you find this helpful as
Yeah.
just some additional educational information.
Good.
So I wanted to just kind of talk about first just some of the benefits of breastfeeding, because people are like,
Yeah.
why should I even go through the trouble? So I
Yeah.
wondered if you could just first just go through like, what are some of the benefits of breastfeeding?
Yeah, exactly. So I like to split it up into mom and baby's health, because those are the dyad, which is the couplet, like we like to use in the hospital. And so it has benefits for both. And a lot of people focus on the benefits for the baby first, but there's also benefits for mom. So we'll start with the benefits for mom, since you are the party that is the biggest part of the breastfeeding, because you have to want to do it, right? It's your decision to make. And so it really helps you deal with your recovery after delivery, helps you release oxytocin, which helps get that uterus back down to size. And so if you've breastfed, you probably cramp and you're like, why am I hurting while I'm breastfeeding? That's that oxytocin at work helping to get that uterus back down to size, which also controls bleeding. So you get a 2-for-1 with that. Also helps with your mood. A lot of times the closeness, that the bonding that you experience with breastfeeding is so important for your overall recovery, for things at risk of like postpartum depression or anxiety. A lot of times it tends to help with that, which you might think if you're at the beginning of breastfeeding, you may not believe that, because it can be anxiety inducing too, because you want to get it right and you're stressed about milk supply. But once you work through those challenges, and actually if you're able to be able to do it, then a lot of times it actually does end up helping the moms feel like, oh, hey, I'm giving my baby some good stuff. And so they feel empowered with that. And that goes along towards helping their mood as well. With the baby, it really helps with their gut development, like so your GI tract, which we've probably over the last, I would say maybe 5 to 10 years, have really started focusing on like gut health. And I think that's like everybody, like adults and pediatrics, actually, because we, that old saying, you are what you eat, is really true, actually, because nutrition is how you're growing. And so your baby actually, like while you're pregnant, you're actually helping to provide the important bacteria that your baby will need in their gut to help process things and help them to be healthy. And so breastfeeding actually provides those antibodies that kind of can line up that GI tract, something called secretory IgA, and help with a lot of different infections. It's been linked with decrease in ear infections in kids, and lower respiratory infections like pneumonias and things like that. And it also helps with weight control too. So with sometimes with formula, we tend to like overfeed, which that's like a whole nother subject I can talk about too. A lot of it because we think our babies eat it, that means that they need it that much, and it's not actually true. Their tummies are really small. So breastfeeding helps to set like a natural balance for their health and even their weight and in infections, and also helps the mood of the baby too, helps them feel close to you. We're part of this society where we're like, and that was driven by formula too, like feed the baby and put them away. Okay, now I have 4 hours to be able to do whatever I want, kind of a thing. And so now when people are breastfeeding and they're realizing their baby wants to stay attached, that's actually the more natural way. If you look at other countries, people are carrying their babies around everywhere in a little wrap, strapped to their chest. And that's actually good for them and for you and for the mood. It's just that culturally we've shifted away from that, but it's beneficial for the baby in that regard too. So lots of different benefits, basically for the health of the mom and baby and the mood. I think I would group them into those big 2 factors. And definitely, like if people are Googling, you're going to usually get the good information about that. I haven't seen too many things where it's something crazy said, like, what kind of benefit is that? It's usually that kind of information that is actually parallel across sites and things like that. So baby health and mom's health and baby mood and mom's mood are the biggest.
Good. Okay, so that's great information about the benefits of breastfeeding. Now, is there a certain amount of time that we have to breastfeed in order to get those benefits for us and for our baby?
When you say time, do you mean like length of time? Like the AAP recommends exclusive breastfeeding for up to 6 months and then up to a year if you can. Do you mean that length of time, or do you mean like, okay,
that length of time?
I think that the colostrum actually, so milk is broken down into like colostrum and then like the mature milk. And so the colostrum is actually touted to hold like all the antibody type and benefits that we talked about. And so I find that so interesting because I've always been like, really, that them 3 days of colostrum was enough to sustain the baby's GI tract is so fascinating, but it's actually true. And then more of the mature milk has more of the water, the lipids, the carbs, the proteins. The way I explain it to family is like the nutrients that we want for our bodies is basically just all up in that milk. Like the things that we're trying to take supplements for is there, like it's all your minerals and vitamins and things like that is comprised in that milk. So I think ideally, I always at least try to encourage families to at least do colostrum, especially my families in the NICU, like, hey, do it at least until your baby leaves the NICU. Like a lot of times if people feel like they have a finite, like, okay, I can at least make it those 6 weeks, it'll keep it. And then they realize like, wait, I've gone this long, I might as well keep going, you know, like that. But sometimes breaking it down helps them mentally wrap their mind around it. But for the health benefits, I would say it's the whole time, but the part about the gut definitely is that part is housed more in the colostrums, with the antibodies and things like that. And then otherwise, it's just the nutrition, just like what your baby would need moving forward, which is why some people will try to argue that, well, formula has these nutrients and stuff, but it doesn't have like the antibodies and the health and things like that. And I actually just came across one paper that was written because a lot of times we will talk about formula supplementation, and I didn't realize that actually even supplementing formula with the breast milk, at least at the beginning too, can actually kind of decrease some of the benefits. That's something new that I just came across. So I actually was going to dive into that paper a little bit more detail, but that's something I came across actually this past week. And I was like, wow, like, and so medicine is always changing. We're always getting more information. Obviously, if someone has to supplement because the baby's small or in the NICU and they need the volume and the feeding, you know, there's also the benefits to that. So it's definitely not meant to shame anyone. It's just kind of understanding a little bit more about what the benefits are. But I would say definitely, if you can definitely do it enough to get the colostrum in them, and then just understanding, otherwise you're providing the best nutrition for your baby. Overall, it's best to go as long as you can.
Now, what about people that are pumping? Are those same health benefits seen in pumping? Because I've read that, like, you know, some of the immunity benefits are seen only with the babies to your breast versus the breast milk being expressed and giving it to the baby.
I would have to argue. I haven't seen anything like that, and definitely send me whatever you've seen too. I would definitely love to look at it. But the milk, the actual substance of the milk is what has the benefits. The part of putting the baby to the breast is to do with that bonding, that closeness. It does help stimulate the release of prolactin and oxytocin, the two hormones that kind of work in tandem for milk production and milk flow is the way. So one makes prolactin is like making the milk, but the oxytocin is helping the milk to flow. And so it wouldn't to me make sense that you not getting the health benefits from it because it's in the milk. But the other more social benefits definitely, and some would argue that the baby is better at extracting than the pump, and that is true unless your baby doesn't have a good latch. Then if you're making, but they still can't efficiently extract, then it's still not effective process. You're still not doing what you're aiming to do. So again, when I'm not a shamer, if you have to pump, like I had to pump, my son was a 31 weeker in the NICU. He was not going to the breast. He was trying to breathe. So I did the best I could. And I got those little colostrum drops and sent those little syringes to the NICU. And I felt good. I was like, you know what? I'm giving him the best stuff because breastfeeding has been linked with reducing something called necrotizing enterocolitis in babies, which is like infection and inflammation of the gut. And so I felt like I was doing my part in helping him not to have that. And thank God he didn't get that. But I do see that in there. So that's why I definitely encourage the moms to, hey, at least do what you can while they're real preemie to help them.
Now, is there anything that when you work with women, that you encourage them to do to help increase their supply?
Well, you can start, the best thing is like your nutrition and hydration. And me and one of my sorority sisters, we did a talk this previous week, and it was one of the things she even brought up about, like, when you're even getting ready to have a baby, just considering your own health and nutrition is important. Like, preparing yourself just in your body for childbirth is such a big part. I think most of us just end up finding out we're pregnant. That was me. And I'm like, okay, well, let me get my act together. But really, like, good nutrition and hydration. You don't want to start pumping or doing anything too early to stimulate, even though some people will find they're making colostrum already during pregnancy, but you don't want to encourage it like yourself extra, because it can actually cause people to go into early labor too. Because again, it's these same hormones that are kind of working. They have more than one action, so to speak. But the baby is the best thing, like that closest with that baby, latching the baby on. If you're not even latch pumping, the stimulation is the sending the signal to your body saying, hey, something needs this from you. Okay. So your baby doing it, like, it's fascinating to me. I learned this in med school about like the baby smell and scent and all these things. And even the cries of a baby, like stimulating you to produce milk. And while I learned it, I had never experienced, I was like, okay. But then when I had like kids, I was like, this stuff is real.
Yeah.
Like, I would be like, oh no, like grabbing my breast when people make me cry. I'm like, this is terrible.
It's real.
It is real. And it's so fascinating. I mean, I'm like, wow, God, like, this wisdom, like, made it just like, so we would always be able to give our kids what we needed, you know? And then there are, and I know you're probably going to get this, and there are circumstances like having a preterm infant, or mom's health, polycystic ovarian syndrome, different things, health in the mom, impaired glucose tolerance, which is something that I even learned about. And so now I start evaluating my mom's charts at the hospital or around. I look to see, does this mom have something in her medical history that might impair how she breastfeeds or make it a little bit more challenging for her, and then she have to do a little bit extra. So definitely putting the baby to the breast and or pumping for that stimulation to send those signals to your brain to release that oxytocin or that prolactin, so you can start making that milk is the best thing. There are other things you can take. I know one of the lactation consultants at the hospital say they can't tell families to take like supplements and other things, which I never asked her, was it because she's a nurse and like, is it the same rules for me as a doctor? But my lactation consultant didn't have any problems telling me. She told me about fenugreek, which helps with the milk production too, which is, I just discovered was in mother's milk tea. Like, I didn't know that that was the substance of mother's milk tea. So, but really nutrition, like things like beans, eating beans, avocado. Basically, if you eat healthy, you're probably gonna make sure that you're helping your milk production and hydration. A lot of people don't drink enough water, and you're burning calories, and it's coming from you. So you have to think about it. Like, it's not something that's poof coming out of the air. Your body is making this, so it needs the right things to make good supply.
And while we're talking about things that may decrease your supply or things that may make it a challenge, I know you mentioned PCOS. What about other things that may decrease a woman's likelihood of being able to breastfeed, or may just kind of slow down that production that they should be aware of?
If people have had breast surgery, that is one. I know I've had some moms who either because they've unfortunately had to deal with breast cancer, or they actually got a reduction because they were having like medical problems from having large breasts. Those are like the big ones that I see often, outside of the other ones. Like I think thyroid, like hypothyroidism, can impact it. It's a host of other things, and then there are like some contraindications like HIV, and is the bigger one. TB, I think, is on the list. I don't see that too much.
What about medications?
Medications. Ooh, so the medications is a big one. I can't think of bad ones off the top of my head, to be honest. I always look at this book called Hales. And it's actually, I think they actually have like a site that families can put their medication into, and it'll give you a class. So, because there are some like things like, well, I'm thinking of the medications I'm thinking of are actually ones for like when you're getting pregnant, like for birth defects. Can't think of anything right off the top of my head specifically that you shouldn't take. There are a lot of different level 3s. There are some pain medications that are probably not indicated, but we've tried to like sift those out even at the hospital. Like we talked with the OB, like, hey, try to avoid giving these. I think Dilaudid might have been one. But I can't think of like routine medications. I know like moms are on things like Zoloft and like some antidepressants. But I think a lot of those actually end up being like L2, like they might make the infant a little bit sleepy, but they're actually like, okay.
Yeah.
I think that's coming to mind. That's like the no. But definitely the Hales is what I usually go to because I don't keep a lot of those medications in my head, unfortunately.
Yeah. I remember, I mean, when I was in the hospital, I remember I asked for a Percocet because they were only giving me like Tylenol and Motrin after I'd had a C-section. And it was like, the Motrin was like 600 milligrams. And it was literally every 8 hours. And they wouldn't give it to me beforehand. And I was like, can I have something stronger? Like when I was in residency, and I know it was like a longer time ago, we would give moms Percocet, and they were like, no, you can't have any Percocet because we found that it could be excreted into the breast milk. And I was like, well, I'm not even making breast milk. And, they offered me fentanyl, and I was like, I don't want fentanyl. So I don't know. It was just kind of weird, but I know they are being a little bit more strict on medications they're allowing moms to have in the hospital.
I still feel like I see some more moms get Percocets. You know what? I'm gonna pay attention a little bit more. I think that I don't feel like that was a hard no. It might be like the volume or the amount.
Yeah.
Because a lot of things I find is, too much of anything or it's also part of it. Like if it's a one-off, it's probably not the same as if that's the one you're doing around the clock for days and days kind of a thing. But again, it really just depends on even those medicines that they say are L1 or L2. If you read further down in that book, it'll tell you like about one infant or two infants that were excessively sleepy. So then you're kind of like, well, what risk do I have? And of course, you don't want the mom to be uncomfortable because that's not going to go any way towards encouraging her to want to breastfeed either if she's in excruciating pain and not happy. So I think you have to balance those things. If it's not like a L3 for me, but it's like a L2 or L1, I think a little risk benefit is what's in order. Especially, I think it's good to get ahead of the pain control. If you can kind of that first day really get the mom like over that hump, then a lot of times they're able to ease into the other things. And once you're like level 10, then there's just no coming back.
Hard. It's hard.
It is. I'm like, control your pain at 5. Don't wait till you're 10 out of 10. You're late then.
Another thing they told me when I saw a lactation consultant as an outpatient, like after I was already discharged from the hospital, she mentioned, which no one had said to me in the hospital, that sometimes a lot of having all the IV fluids can sometimes impact the breast production, breast swelling. And I was like, oh, okay. She was like, did you get a lot of fluids? And I had gotten a lot of fluids because I was being induced and my blood pressure got really low. So then they gave me a bunch of fluids. And then after my section, I was kind of hypotensive. So I had like a ton of fluids. And so I thought that was interesting because I hadn't heard that. And she's like, yeah, she was talking about her personal story and how it affected her, and no one had told her. And then she lost all this weight of water weight, and she noticed that it kind of impacted her flow.
Yeah, we definitely talk about that. And also, it also impacts the weight of the baby too, we found. So we actually have this new tool that we use because one of the things when we're helping families breastfeed is we're watching like weight diapers, poops, and weight loss to kind of know, is the baby getting, and all babies lose some weight because of water and things like that. But we were finding that moms who have gotten more fluids, their babies lost a whole lot at first. And so they get this impression like they were just losing all this weight, but it was really all that excess water they were being off. And so some people now are saying to compare, like say a discharge, if I'm sending the baby home in 2 days, to compare it to the 24-hour weight compared to the birth weight. And I had a baby like that actually, what today is, like Saturday. It was the same, like that Friday and Saturday, it made it look like he had lost like 12%. But when I used that number, it only reduced him down to 9%, which is still up, but I was a little bit more exhale, at the 9% compared to 12%, because I felt like he was otherwise doing well. And even as I've kind of gotten more on my breastfeeding path, because we don't really learn, especially in pediatrics, like breastfeeding medicine. We just learn the benefits of breastfeeding. No one had taught us like how to help a mom breastfeed and be encouraged. And it was traditionally like nurses that were becoming lactation consultants. And I feel like for me, over the past maybe 7 years or so, I've seen more doctors doing it, and which I think is important because we're a big part of the healthcare system and the baby and mom's journey. And so us having that information will help our families better. And so I've learned a lot over the past 2 years as I've personally just decided, hey, I want to like know more so I can help my families better.
That's good. Yeah, that's helpful. Okay, so I thought next we could switch into like when we should know, or like if our doctor is suggesting that we supplement, just kind of what kind of things is the doctor thinking when they're making that suggestion? I know we briefly talked about weight loss.
Yeah, that's usually the biggest thing. It's funny now when I used to always just use like if we're at to 8%, I start asking the lactation consultant a question. So, and I think some of it is because I was a breastfeeder. So I'm a little bit more sensitive to it compared to my male colleague at the hospital. He's always like, formula. And I think, you know what, it's something to be said about experience does matter. Like his perspective is different. He's just thinking, I don't want a baby to be dehydrated and hyponatremic and all this other stuff. I'm thinking, well, I don't want this mom to be discouraged and feel like she's a failure because her baby is, losing what's probably some natural weight, and probably a few things need to be shifted around, like latching and or how often, because it's moms and babies are learning together. So for me, 8%, 9%, I'm like, okay, I talked to the lactation consultant, because they usually go and do a latch score and other different assessments to see, okay, does the baby have a good latch? How many times is the mom putting the baby to the breast? So if we have some wiggle room, like the baby's been peeing, otherwise doing okay, a term baby, I will be like, okay, mom, okay, she might have fed like 7 times in the last 24 hours. Okay, let's try to go for 10 times. Let's go a little bit more frequent, see if your baby just needs to get a little bit more. Let's try it going on both breasts. I do a little bit more deep dive instead of just like formula, because they, a number, because a number, sometimes it's good to use numbers, but sometimes it's so restrictive and you have to look at a case by case. So it really will depend on your provider, to be honest, like how comfortable they are with breastfeeding and their knowledge base around breastfeeding and the history of the mom and the baby. So it's not a pretty answer, but it's a truthful answer.
Right. Yeah. I know it's not one.
Huh?
It's not one size fits all.
It's really not, and it shouldn't be. Like, I mean, if somebody's like at 15% weight loss, I'm like, all right, we gotta, we can figure out all that, but we still need to do something in the meantime, kind of.
Right.
And I try to encourage, if a mom is able to pump or hand express. I was able to hand express, or even that hand pump was like my favorite. I know a lot of people's like, I hate that hand pump. I'd sit down and get a good little bottle full with that little Modelo little hand pump. And then I'd be mad when it break. I'd be like, dang it, I need another. Who can give me another one? But I would ask the mom to pump after they fed and see if they can supplement more, because really, and we just, I wish I had brought it with me, but we just at the hospital created this sheet for families to kind of gauge volumes that they should kind of be expecting, which is not even nowhere near to formula volumes that people are doing, which is, I think we need education about that too, like I said earlier. But really, if they're extreme weight loss, that the baby's like not responsive, looking lethargic, things like that are issues where you need a supplement. There are medical conditions like galactosemia in a baby, which will usually be found on like the newborn screen that we do at the hospital. Moms, that's where they prick the little heel and do this little paper, and it's looking for common like genetic diseases that you want to catch sooner than later, so you can intervene, because there's usually a medical intervention that's life-saving. But galactosemia is one, which I've even recently found that there's more than one type, and so depending on the type, you might still be able to breastfeed, but that would still require more in-depth discussion with your pediatrician to make sure you're not harming your baby. So that's one big one I know of, that a medical issue. And I think Fetal ketonuria, I think that one you can still do some, but you still have to supplement because they need to have the right nutrition in that case too. So there are definitely some medical things that babies can have too. Preemies are a big one, only because one, depending on how small they are, they're just not going to be eating at the breast right away. And then even if they're like, even some of my 35, 36 weekers, they just tire so easily at the breast and can't sustain. I mean, breastfeeding is work, okay?
Yeah.
That's why babies like the bottle just pour in their mouth.
Uh-huh.
They don't have to do nothing, just drip in there, you know, if they want to just swallow. But breastfeeding, you have to, you know,
Yeah.
have to get to sucking and extracting. And then at first there is usually not as much as we think that they will want, but actually ends up really being enough for the term baby. But those are the bigger things that volume, weight loss, like you said, they're not peeing, pooping. You should be looking for some actual objective signs, not just, and you know, at our hospital, we're working on it, but it's really the comfort level of the staff and the provider that is with you. Like some of our nurses who are breastfeeding are a little bit more patient, a little bit more encouraging versus the ones who didn't. They're like, look, like it's sad but true. It's like, I don't have time for this. Get this baby a bottle, which is unfortunate because then it's these moms feeling like failures and they might have just needed like one tweak or one conversation. Like yesterday I was running with a mom and I actually had them 6 years ago. It's funny. I remember mom's faces. And I walked around, I was like, I feel like I know you. They was like, yeah, you had us with our first. And she was like, I'm trying to feed her. And I was like, well, let me examine her. And then I'll help you get her latched on because I've been getting in there more myself now. And so she was like, man, I felt so defeated last night. I was like, no, we don't do defeat. We don't do that. We're going to work on that. So gave her my tips. And I know people talk about this football holds the latch, but I've coined a new term and I'm calling it the bicep curl. Okay. And so you're going to bring that baby to the breast and see, I asked them, can I demonstrate the baby? And I curl them up and they get that visual like, okay, bring the baby to me. Because a lot of times they want to lean down and that's uncomfortable. If you're not going to keep doing something if it's uncomfortable, you like got to do that around the clock for days and days and months, right? So she did that. She did her little C shape, making her nipple sandwich like I would call, and the baby like with the work. And we were so excited doing a little jig. And she was like, man, this is so good. And I could see the emotion of happiness, like, because she had felt defeated. And I was like, see somebody not taking the time. I could have just been like, look, if the baby don't want to eat, just look, give him some formula, it'll be all right. Like, no, like it was just that she needed a little tip here and there. So a lot of times we just need to know where we are fall short in our education and just be willing to learn more so we can help people better.
Yeah, and it sucks that it's like it's different. Like people get these different experiences, you know, like I had a lactation consultant who was amazing. Like she was so great on my first day. And she had me pumping because she was concerned. She's like, you know, you had this breast surgery. Let's just try to stay on top of it. Yeah. And so, you know, she worked with me a lot. And it was defeating because I was like pumping air and I'm doing that every 2 hours. And I'm like, I'm pumping air. And then I'm washing the parts. And I'm like, oh, really? You know, and so then the next day I remember I had a different lactation consultant. And somehow she found out I was a doctor, which I didn't tell anybody I was a doctor. Somehow she found out I was a doctor. And she was just like, I mean, you whatever you would tell a patient, like you should just do that. And I was like, but I've never done this before. Like I've never been this before. But it was like very strange. It was like she didn't really, and you know, and when you're in that position, you're like, I just want someone to tell me what to do because I don't want to have to decide. I don't need, you know, I don't know. And yeah, she just didn't really give me any guidance. And then when they told me like the baby hadn't peed in a day, and I was like, well, I think we should give them something. I don't know. I mean, I don't want to, you know, yours were starving your baby. I'm like, I don't want to starve them. I mean, I don't know. And so, but it is, you can see how you can have like completely different experiences.
Yeah, you can.
Who's there, which is challenging.
Yeah, it is. And I know personally in our hospital, we are working to standardize it. And I've joined forces with our lactation consultants to really get around that education. And we're trying to put like a coalition of you know, together to have that support. But you know, like even me, I ain't gonna lie, I was breastfeeding around the clock and my daughter waited until I felt like I gave her 5 cc's of formula at the 25th hour because she hadn't peed. And that little girl peed. I said, you know what? That wasn't even because of that. It was just being difficult.
That's right.
Because then I had lots of like colostrum. I think she was just being stubborn, and knowing who she is now, I know it's true. but yeah, but I even had a pediatrician in the hospital try to shame me because I gave my baby like the 5 mLs or 4 ml. I was like, ma'am, look, I'm at this point where I want to make sure. There's always still that you're not sure. And I didn't want to go too much longer because again, I do this for a living too. And I know I've been put on breast, but it came to terms when I went to see a lactation consultant, I needed to do a better latch. So then I was like, well, she might not have really been getting what I thought because my latch could be a little bit better. And again, it was the same way for me. Like I pumped with my son. So I didn't, and I made a lot of milk. So I never had to worry about a latch because he was a Nicu. By the time he came home, homeboy was like, girl, just give it to me in that bottle. We're not doing this. Because I used to try to put him to the breast and he would be like fighting me because he was using the flow already. And he was like a month and a half out that game. I was like, look, he's getting the milk. Yeah. To me, that's important. We could skin to skin and he could get the milk like that way. That's how we did. We still bonded that way, I think. But my daughter was actually able to put it on. So that was, that was new. So I still had to learn. Once I sat down with a consultant and learned about the latch, it made sense. And then things went better from there. But see, just because I was a pediatrician didn't mean, again, like you, just because you're a doctor don't mean your experience is only your experience, no matter what your education.
And sometimes you just want to be the patient, you just want someone to tell you what to do. Don't make me have to think about it. But I feel like my baby also
my own doctor today.
It's tough. It's tough. All right. I want to ask you some rapid fire questions that people submitted.
All right.
And some of them, they're supposed to be rapid fire, but I know that's probably, it's hard to be.
It's okay. I'll do my best.
So somebody asked what to do if they have inverted nipples.
Okay. So you can pump to get them out. And actually your nipples are erectile tissue. So I'll have my mom's, it's funny. It's a good question. Like yesterday that mom was telling you about. So she was kind of flat and I was like, all right, mom, grab your nipple and twist. And she looked at me like, what are we doing? I was like, this is my professional recommendation. Then she did it and she realized because that thing popped out and then she laughed. But her husband was standing right there. I was like, his face looked like, what we got going on around here?
Yeah, because your nipples, it's a tendon. So it's a tendon, so they can come out.
Yeah. So actually twisting that, seeing that, pumping, some people have to use a shield, but again, that's meant to be a temporary solution too. So sometimes people use it and they haven't really gotten the education around it. But that I would definitely talk with a lactation consultant if pumping doesn't bring them out. And I think there's something, and I'll try to look it up and get it to you. There's something one of the lactation consultant told me about that you can buy that actually helps to pull them out. It's some kind of cool, little device thing. I'll get it to you because she told me. It's like, I need to add that to my list of tools to tell people about. Yeah. So
okay.
That's the answer.
And then what about purchasing breast milk?
Purchasing.
Can people purchase breast milk if they can make their own?
Yeah, like donor milk. I would say that you need to do it from a reputable source. Do your research, okay? Because you need to make sure it's a place where they're testing the milk. You don't want to be providing, just like anything else. You don't want to be giving your baby something that's actually not been vetted. I think if you can, I think that's a great thing. A lot of hospitals we do in the Nicu, we have donor milk and stuff. Not in my current facility, but other hospitals I know do use donor milk. And so it's definitely life-saving for sure, especially for our preemies.
Good. Somebody said when you do have to recommend formula, is there a specific brand or whatever that you recommend and why?
Well, if you had asked me before, I probably would have been like Similac. But we've had this recall situation lately. Look, I don't want to get into any legal trouble here.
Yeah.
But I will.
Is the recall over though?
I think it was just certain cans, to be honest. It wasn't every can. They had a certain numbers and everything. And so I'm pretty sure that is probably resolved. But I know just like when Chipotle had that E. coli breakdown, I'm sure people didn't go there for a while. You just got to build back up that trust factor. I will tell you this, when I was in fellowship, it was Team Similac and Team Enfamil. We had the fellows had one team and then the nurse practitioners had the other team, and whoever team was on, that's what formula your baby got put on. So I say that to say it really is no preference. You have to try it. Some babies will eat everything under the sun, and then you have that baby that don't want anything and you have to go through it. And I feel bad for those families who have to go through it, but it is a very real possibility that you'll be trying different formulas. I do try not to knee jerk though, because like a spit up here or a little gas there. But if it's like a pattern and if it's like distressing, then I'm not one of those to make people suffer. I'm like, let's just change it. Because again, to me, it's kind of like Coke and Pepsi. You got two brands and somebody might like a Coke and somebody might like a Pepsi. That's the way I think about it, to be honest. And unless your baby has a medical indication, because if you're doing WIC, which is the Women and Children's program, that the government has in different states. They will, some have Similac and some have Enfamil, like, or Gerber was one, like right now in here in Georgia, it's Enfamil. So I tell my families we have Similac in the hospital, but I tell my families when you go home, the equivalent of this Similac sensitive we put you on will be like Enfamil Gentle-Ease, because it's about what's in it, less lactose. So some babies, I feel like in general have this theory, it's definitely not been studied, but I feel like I've had to put a lot more babies on sensitive formulas, which I feel like we were talking about this whole gut health and all these different things and all the food we're eating and passing on to our kids. There's no telling how that's impacting their GI tract, even at birth, to be honest. We're learning so much, even about antibiotics and things like that. So I definitely think, to get back to the point, that I personally don't have a preference. I think do your research. If there are some more natural type, I think there's some even that I've seen people get that from overseas. That
I've heard about those
here. And so, I think when you know better, you do better. And there's something that you've studied or you've definitely talk with your doctor. That's the biggest thing. And even your doctor may or may not know about it. Bring the information, have a discussion. That's the best thing you can do to make sure that you're feeling your best about what you're feeding your baby. But it really is going to be up to your baby who's going to decide. They're really the boss.
Now, what's easier, breastfeeding or pumping?
Ooh, it depends on who you ask. So there are some people that do not want to deal with the pumping is maintenance. I will tell you that, because I have done both. And so I've definitely been in those times where, ooh, I'm glad I could just pop this girl on, because that milk was starting to flow and I needed some relief, and she was right there. Okay. Pumping, you got to get the set up depending on what you have. You got to clean the parts every time because the tubing and all of that stuff. So ideally putting the baby to the breast is definitely easier. But when you're away from baby, pumping is definitely helpful. So I think that's my answer.
Okay, that's good. Let me see. Okay, so somebody asked, they breastfed their first baby for 13 months. They're pregnant with number 2, and they're trying to decide if they want to breastfeed or not, because with number 1, it felt like such a chore. Any just advice you can give them?
No, you are a champion. Whoever you are, you need to give yourself a badge. Okay. I think I went like 9 months, and then I started trickling in some stuff because I started working, and it was hard to, again, back to pumping. I work in the Nicu. I might be having to go to a delivery at the time I was supposed to be pumping, and my breasts all engorged and licking into the nipple pad. So I definitely get it. It is, don't look at it like a chore, mom. Look at it like, hey, well, let's be real. Parenting is a chore in that case. You got 18, well, for the rest of your life, okay, to do it. So look at it like this, like I'm setting my baby off on a good start. I'm giving them the best. As parents, we're always trying to give our babies the best. So this is one of the best things you can do to start. And then you might feel guilty that you did it for your first and not the other, because I see people do that too, like, oh, well, I could have. I don't want you to look back with regret too and be like, well, I could have done it. I did it for so-and-so. And the fact that you did it with the first baby, you're actually probably have a better experience because you'll be a little bit more prepared for what to expect. See, like experience, it doesn't change the outcome always, but it makes you feel a little bit better because you know what to expect. Like, okay, I know going into this, I know what to tell myself when I feel like this, or when I'm tired, or, I know a little bit more. They probably have more resources out there now in terms of, like if you need to pump, better things like that Haka little nipple breast pump thing I saw that was out that Jeannie Mai was promoting. So see, they didn't have that out when I was breastfeeding. So, that looked like something you just pop on and whoop, here come the milk out. See, so they're making it a little bit easier for mom. So I think that it may be a better experience for you. So please do it, mom. And just do, at least, like I said, at least get them that colostrum at least.
Good. Okay, Dr. Jess. So now if people need some extra support, how can they work with you?
with me. Okay, well, I am setting up myself to start working with people, but I currently have a landing page that's www.momandmemd.com/stop overwhelm, because I don't want moms to be overwhelmed. You know, it does come with the motherhood thing, but I think if you know what kinds of things can stress you out, you can make some plan to attack those things, right? Because motherhood is on the job training. Breastfeeding is on the job training. Basically, everything you do with a child is on the job training. And nobody talks about that. Like, they just talk about, oh, it's, you know, oh, what name and what sex and what color we're going to put in the nursery, and oh, we got to get a car seat. It's all, and these are all important things. Like, definitely, I'm not downplaying it, but really the recovery of mom and the unknown normals of baby are the things that really provide people with stress. And so we need help during those moments. So that's what I aim to do. So on that website also is a Calendly link to do a free consultation with me to see how I can help you in your motherhood journey.
Wonderful. Well, we'll make sure I'll put all those links in the notes. And I definitely recommend reaching out. I think that it's not something we should do alone. It can feel so isolating. And so I think just having someone to talk to, and it can just make a world of difference, and having that extra support.
Yeah, I agree. I know when I brought my son home, you know, he didn't do nothing wrong. And he was like the super preemie, actually. But then that first night, he decided he wanted to choke on his milk and turn on me. And I was like, why are you doing this? Like, I know CPR, but you don't have to test it. And so I was able to like phone a friend. Even me as a physician, I needed to call somebody just to be like you talked about the ledge. I had to be like, girl, you know what he just did? And, you know, she was a neonatologist. And so she just helped me to, you know, and it went on to, I actually had to put an EG tube back down and feed him. And it was stressful those first couple of months of him being home. So I definitely have lived it too. And until I had kids, I kind of felt like a fraud. Like, ma'am, I don't know, ma'am. I'm just going to tell you what they told me in training. Right. Once you have kids, it really does open your worldview to the struggle that parents really have. And I felt more anxious because I felt like, well, I'm supposed to know more. And while I knew the answer scientifically, it still didn't take away my anxiousness about it, because sometimes I knew too much, actually. Like, oh Lord, he could have this or that, you know, and my mind would kind of go way down a path that I didn't need to go down. And my husband he kind of helped to talk me off the ledge too. He was like, it's okay. It's okay. And you need somebody to just say that sometimes.
Yes.
So, yeah.
It's okay. It's okay. And you're doing a good job. I think
yes. You are a mom. And I have two things. One, you have a baby, you become a mom, but being a mom is forever. So, you know, that you're not gonna, so the things you worry about when they're 1 month old, it's gonna be different when they're 1 year old versus 10-year-old versus 20-year-olds. Just ask your own parents. They gonna tell you.
All right, Dr. Jess, thanks so much.
All right, dear. Have a good one.
You too.